radiation oncologists is really interesting to me. I think it's the best field of medicine. There's a great variety of work that we do. It starts when a new patient is referred to us. So some other doctor thinks a patient needs radiation, and they call us up and say, I'm sending you this person for your opinion. So it's our job in that hour or hour and a half meeting with the patient for the first time to review their pathology, their diagnosis, their prior treatments, and decide whether radiation is appropriate, and if it is appropriate, how much radiation should be given, and to what area. And then we also have to be conscious of the fact that sometimes chemotherapy or other therapy should be delivered along with the radiation, or should precede the radiation, or we should do surgery first and then radiation, or radiation first and then surgery. So cancer is not one disease, it's hundreds of diseases, and each one has its own twists that the radiation oncologist has to be aware of. From there, a patient, if a decision's made to treat a patient with radiation, we would have to plan the treatment. And so we do that with a special type of CT scanner. We'd create a three-dimensional volume of the patient inside a treatment planning computer so that we have a model of them, and they can go and live their lives while we're hard at work planning treatment. The radiation oncologist is heavily involved in the treatment planning process, telling the computer what's normal and what's abnormal, what needs to be treated and what needs to be avoided. And there are dosimetrists and physicists and other staff who help with that process. From there, we'll come up with a plan. And the plan is essentially a computer program that tells the machine how to behave. The same machine is used to treat almost every patient in the department. In the same way that an industrial robot could build a Mercedes-Benz in one factory, and then that same robot could build an Audi in another factory, the robot is the same, but the computer program is different. And that's how radiation works. So we create a computer program, we'll verify the accuracy of that computer program, and then that usually starts a process of many days of radiation therapy delivered Monday through Friday for, let's say, an average of 6 weeks. Sometimes longer, sometimes shorter, but that's about an average. Once a week, we'll see the patients on treatment check. So we'll take that day out of our schedule and we'll just see the people that are under treatment. And that could be somewhere between 15 and 30 patients for the average radiation oncologist. So you get to see them frequently while they're under treatment. And you're managing side effects, providing elixirs for the throat, these sorts of things. Skin creams, nursing care and education gets provided. So it's a real collaborative effort. There are some very important people called radiation therapists who deliver the treatment, and they're kind of our front lines. They're seeing the patients every day, and they'll often alert us to changes in the patient's status that would require intervention or evaluation by a physician. And then the patients will come back for months and even years after treatment in follow-up, and you get to see not only the side effects of radiation to make sure that those are being managed, but also hopefully you get to see a smiling, happy person who's cured, and that's, the greatest joy that I have.